Hi, everyone. My name is Trevor Sanchez. I am a senior nursing student from Concordia University, Wisconsin. And this semester, I was able to participate in a preceptorship in the emergency department at Sheboygan Memorial with Tyler Haas. And I am also an extern in the ED as well. For my senior capstone project, I did a quality improvement project about hand hygiene. So, a little outline for our discussion today is to define hand hygiene and the best practice guidelines, the impacts on staff and on patients, some observations and gaps in care, and contributing factors, and then recommendations, and finally, financial implications. So, what is hand hygiene? Hand hygiene is a way of cleaning one's hands that significantly reduces the number of pathogens that are found on the hands. This is important so that we're not spreading um, infections from patient to patient. So, what are the best practice guidelines? Advocate Aurora Health's policy states that employees are expected to use alcohol based sanitizer when entering and exiting a patient's room, and to wash hands with soap and water if gloves are visibly contaminated. And when using an alcohol based product, enough sanitizer should be applied so that the hands are wet for at least 30 seconds. So, some impacts of hand hygiene on staff. Um, Washing your hands is going to protect the employees from infecting themselves with a pathogen from a patient. Um, we deal with a lot of uh, different pathogens at work, and we don't want to be bringing those home to our families. Um, and also, preventing infections from patient to patient allow for cost-effective care, which can allow for monetary raises and bonuses. Some impacts on patients: we see decreased incidence of hospital-acquired infections, a decreased risk for the development of sepsis, decreased mortality rate when compared to patients who contract nosocomial infections, and decreased length of stay and cost of care. So, some observations and gaps in care. In the August 2021 hand washing audit, only 3 out of 13 of observed ED employees completed proper hand hygiene. That's only 23%. Only 1 out of 5 nurses completed proper hand hygiene during the audit, and 0 out of 2 techs completed proper hand hygiene. Overall, on this audit, the hospital only achieved a 59% compliance for hand hygiene, and the ED compliance was the lowest out of all units in the hospital. Over the last 2 years of audits, Sheboygan Memorial has had an overall compliance of 71%, and the ED specifically has fallen below the mark at an overall compliance of 53%. So, what are some contributing factors to the lack of compliance? Lack of knowledge related to hand hygiene, not knowing what scenarios hands should be washed in or how long to wash hands for, lack of hand washing materials, i.e., soap or hand sanitizer. I know the hand sanitizer pump between triage and room 13 runs out frequently. I find myself pumping there and not getting enough, so I have to go find another pump. And sometimes people aren't taking the time to do so. Misunderstanding when it is appropriate to perform hand hygiene, and the urgency of care needs in the ED does not allow for proper hand hygiene in all scenarios. I know we see a lot of urgent cases in the ED, and we want to get them care as quickly as possible, but it's also important to remember to um, perform proper hand hygiene at the same time. So, some recommendations or goals for this is to create an environment where hand hygiene is prioritized and valued. Proper hand hygiene habits are created and sustained. And finally, staff members feel comfortable and confident about when hand hygiene is necessary. So, here's some suggested steps to achieve those goals. First would be to educate nurses about Advocate Aurora's hand hygiene policies. That's like the gel in and gel out, things like that. Establish hand hygiene champions who can drive the spread of correct hand hygiene information through the unit. And what a hand hygiene champion is They should be differentiated from a compliance auditor. They're not just there to point out the wrongdoing of an employee, but to come alongside of them and make sure that they understand why it's necessary and how it should be performed. And they should be dedicated to overcoming resistance and improving compliance. Another thing is to rotate the signs that are on or near the sanitizer pumps in correlation with the season or the holiday to draw attention to the pumps, and also to utilize the CDC Clean Hands Count campaign if we need additional resources to promote hand hygiene. So, some financial implications. Um, the cost is going to be minimal. So, hand hygiene champions are going to be employees from the unit, and they can receive training during their shift, and they could be denoted by something as simple as a gold star pin, which can be purchased on Amazon um, in a pack of 20 for under $20. This is an easy way to start a conversation. Hey, why are you wearing that gold pin? Oh, I'm a hand hygiene champion. Let me tell you what that means. So this will start the talk in a shift in culture around hand hygiene and the compliance. And then there's a lot of free to use resources like um, the CDC's Clean Hands Count campaign. Savings. So the average increase in length of stay due to hospital acquired infections is 5 days. And the average cost of 1 day in the hospital is $2,607. This means that the average total cost due to hospital acquired infections for one patient is $13,035. That means preventing infection is saving us money. And why that's important is because when a patient acquires an infection in the hospital is going to have to pay to help treat that infection and help the patient recover. So, some references that I used are included here. And if there's any questions about how we can implement this or other ideas, I'd love to hear them. And I can be reached at trevor.sanchez at aah.org. Thank you.